No jab, no job. That's the policy in Zimbabwe and more countries around the world. And it's not just public servants who have to get inoculated, employees at private companies too.
So you got it's your get pass. If you don't have your get pass, back.
That means no work, no salary. Some unions call the policy intrusive. Others say mandates are a must. Welcome. Zimbabwe says this is about the preservation of life. It's introduced a vaccination mandate for some 300,000 public sector workers. Vaccine hesitancy is a growing challenge. From Harare, DW's privileged Musfanhiri reports.
Garikai Matlengwe is a teacher at a public school in the capital, Harare. He, like many other civil servants, was vaccinated, but only out of the fear of losing his job. Garikai considers mandatory vaccination for public workers as discriminatory and a violation of the freedom of choice.
I feel we've been robbed of our rights by the pandemic. This mandatory vaccination, if it was to be mandatory to everyone, it should not have selected civil servants, because it seems as if civil servants are the only human beings here and are the main spearheaders of COVID-19, which is totally wrong.
Despite the call for public workers to be vaccinated, the vaccination rate has not gone up as expected. There are hardly long queues at vaccination centers if compared to a few months back when the country was hit by the third wave. While vaccines may be readily available at vaccination centers like this one, it is the citizens' response that is a bit low. It is a trickle against what health authorities may be anticipating, perhaps because of the conspiracy theories surrounding vaccines. Zimbabwe is targeting vaccinating 60% of its population, hoping to get close to herd immunity. That accounts for 10 million out of its 15 million citizens. The government says mandatory vaccination means just that. Some individual rights have to be restricted.
The government is saying you need to be vaccinated so that you protect yourself and you protect those who you serve. Public servants are always working in public places, they are interacting with the public, and we need to make sure that all public servants are vaccinated.
Worker unions have challenged mandatory vaccination in courts, but are encouraging the government to provide vaccines to all citizens willing to take up the jabs.
It is illogical to force an employee to get vaccinated, at the same time allow the same employee to interact and mingle with a person who is not vaccinated.
For Garikai Matlengwe, a vaccination card is now the passport to work. At least he is guaranteed a salary. However, his case is not unique. Many countries across the world are now moving towards COVID passports to access services.
Charles Shea Wasonga is director of the Cochrane Centre at the South African Medical Research Council. Tell me, in your opinion, where this vaccine hesitancy in Zimbabwe comes from.
Yeah, you know, in Zimbabwe, like in various other African countries, surveys have been conducted which show that people have concerns about the effectiveness of the vaccines, of COVID-19 vaccines, about the safety of the vaccines. And there are some people who think that they are not at risk. And also there are also conspiracy theories where people think that COVID itself or vaccines could be part of a plot to harm them in some way.
So what's your message to the doubters, to those who are hesitant about taking the vaccine?
I think for those who are doubting the safety and the efficacy of COVID-19 vaccines, what I really want to tell them is that vaccination is one of the greatest weapons that we have against infectious diseases in general, and also in particular against COVID-19. vaccines. Before the COVID-19 pandemic, we are saving about 5 million lives every year, and this includes lives of children in Africa. And we could save a lot of lives with taking COVID-19 vaccines, and people should trust the COVID-19 vaccines. Before vaccines are approved in Zimbabwe, in other African countries, there are various committees that look at this, various checks and balances, from international bodies at the World Health Organization to the national regulatory authorities, where they look at the data, and before it is approved, everybody is convinced that the benefits far outweigh the risk. And it is the same thing in Zimbabwe, it is the same thing in other African countries, and we should trust them.
Charles, that message hasn't been getting through, unfortunately, to a lot of people. So Zimbabwe is having to force public servants, for example, to take the vaccine. Is their plan actually working?
I think usually with mandates like the one you mentioned in Zimbabwe, there are issues because there might be problems with how do you implement them. What penalties would you put on people who do not get vaccinated, and how are you going to monitor this? So those are challenges in terms of implementation. And as we know that there are various reasons why people might not take vaccines. We have just talked about hesitancy, but there might also be issues around supply, availability, and access. And if access is an issue, mandates would not help. If supply is an issue, mandates would not help. If people do not have a convenient time when they can go for vaccination, mandates will not help. Vaccination might be part of the solutions. We need to do more.
So tell me, is a vaccine mandate the way to go, or are there other measures that make more sense?
The vaccine mandate might be one of them, the measures, but it would have to only happen if there is enough consultation. But there are other interventions. First of all, people doubt the safety and efficacy of the vaccines. We should provide the right information. We should understand what the concerns are and provide the right information, not only once off, but continuously, to ensure that people trust the safety, they trust the efficacy of these vaccines. And mandate in some instances might have a role, but they are not the panacea.
And is this the way to go for other African nations, not just Zimbabwe, using a mandate? I don't think so. I think it is good to consider them, and it is good to start consultations in various countries to see if that becomes the way to go, how to implement that. But we should start by improving access, improving availability, ensuring that vaccines are available at convenient times, during weekends, when people leave work, so that people can have access to them, providing the right information about where the vaccination is taking place, about the importance of the vaccination, and just hold mandates to be the last resort. And Charles, is there any other way besides that access and providing that right information that will build confidence within the public in these vaccines?
Yes, there might be other ways. You know, very often vaccine hesitancy might not just be at the individual level. People often, by refusing vaccines, they are expressing who they are. And this might be linked to other needs that they have. If, for example, they have malaria as a serious problem, tuberculosis as a serious problem, and nobody is solving those problems, poverty is an issue and nobody is solving them, and the government is only insisting on COVID-19 vaccination, they might tend to think that there is something else behind the COVID-19 vaccination. So I think we should use COVID-19 vaccination as an entry into societies to try to solve the various basic health issues that people have.
Charles Shewasonga, thank you very much for being on the show today.
Thank you so much.
Derek Williams' turn to answer your questions, and this time, the vaccine's effect on women.
Some friends have complained about menstrual irregularities after vaccines. Do they occur?
At this point, we still can't really answer this question, but the issue has popped up again and again in the media. So let's look at what we do know. A relatively small percentage of women have reported long-term changes in menstruation after receiving COVID vaccines. The complaints often involved heavier than usual bleeding or changes to cycles. However, reports like that don't really prove much because they're anecdotal. If there's a link between menstrual irregularities and vaccines, then that link will have to be verified through observations in studies. And quite a few of those studies have now kicked off, including 5 comprehensive ones sponsored by the National Institutes of Health in the US. They'll be going on for about a year, although I'm sure that we'll see data a lot sooner. The experts say the really big problem with trying to establish links like this, if they exist, is that they're hard to prove. That's because menstruation can be influenced by a wide range of other factors as well, including stress, which is very hard to calibrate. So demonstrating really clear causality is going to be difficult, they say. But because the reproductive system in women is unquestionably influenced by the immune system in big ways, I didn't read anyone who's ruling out the idea that a vaccine could conceivably have an impact on menstruation, although pretty much all of the experts also seem to believe that even if effects occur, they're almost certain to be fairly rare and short-term, so they shouldn't last longer than a cycle or two.